positioning. All right, so basically you're gonna wanna make sure your patients are positioned properly so as to avoid any kind
Can we have
of,
your name, ma'am, please?
no.
Yeah.
Like you don't want their bony prominences on something hard so they get sores or breakdown or redness. Those are your arm jellies for your arms. Arms are always supposed to be facing up. You have your heel jellies so that your heels aren't on the bed for longer cases and you don't get any redness. Your jelly donut for the back of your head. We used to use these as our Lamy rolls. They're smaller. Sometimes we use them as bumps now under the hips. Sometimes, I mean, if it's a smaller patient, you could probably use them as a Lamy roll. But these are our big boys. They're heavy for patients that are prone. You want to make sure that they go from axilla to, I guess it's the iliac crest, I think they said in the paper. You want to make sure the girls are in the middle and everything's clear and not compressed. Going along with those, come on Gary, I need to be down. You have your prone view. This part is found in the little anesthesia office on their desk. This part is found in Helene and Tracy's area in the anesthesia room over there.
On the bottom shelf.
Yes, bottom shelf. Anesthesia should get this themselves. If not, this way you know where it is and you can grab it. This is disposable. This gets cleaned.
Do we just have one prone view?
We have one of these and then multiple of these. Yes.
So I know there was an issue, like, they
Yeah,
had to wait.
I think we're getting
for
another
the
one.
second.
I don't know about
Because it
that.
had to be clean.
Anesthesia needs to make sure, you know, their eyes are clear. Obviously, they're tubed because it's a tube and turn, that the tube is clear and all is well.
And by cleaning, we mean it's got to go to SPD.
They go to SPD, yes. You can clean it here first too and then take it to SPD, but yes. With that being said, when the patient is in prone, make sure you have a stretcher outside of your room in case, God forbid, there's an emergency and you have to quick flip your patient back over.
Now, you mentioned the girls.
The boys,
Let's
make
not
sure-
forget
make
the
sure the
male
boys are,
anatomy.
are free of everything as well. You want to make sure everything is clear and not compressed.
Thank you.
Dr. Ward, when he does his ankle scopes and some of his procedures, he uses his bone foam. This can be wiped down with our regular wipes when you're done your procedure to clean them. It will go like this to the patient, the leg will come up and over. He also uses the leg holder. I personally, sometimes he doesn't like to do this, I make him do it. I put a jelly on it because it's harder.
Yeah.
He'll position it how he wants it. You just use your little clamp on the bed and then feed the hole through. This, he can position this however he wants as well.
So he uses amniotic scopes.
Uh-huh.
He uses amniotic scopes.
For his ankle scopes, yep. Dr. Tashio will use this for under, when he's doing his ears. For under the head. You can also, they have axillary rolls out and about out there. We don't have any gel axillary rolls. You could roll this when a patient's on their side to stick it under the axilla. You can use it as the bump. Let's see. We have pain. This is going to go under your ankles so that your toes are not, their toes aren't hitting the bed. These are for arm support for them. Sometimes these fall out a lot, and if the patients can fit their arms on their bed, we just let them do that, but that's for that. Also, if you have a patient that's a little more robust and you need to tuck their arm at their side, you can use this to keep their arm tucked, but just make sure you put a gel there. Put your gel arm pad there as well. You have the beach chair for your shoulders. I'm not going to put it on the bed, it's a lot. I'll just tell you, you're going to take your foot off, and then you're going to put the foot pegs down, and the beach chair goes on that side of it. You spin your bed, it's a whole big thing. Just know that that beach chair and lives in Helene's room, and you can find someone that does it a lot, and we will gladly help. Along with the beach chair, this is the arm support that goes with the beach chair for your non-operative side. And This is, what do they call this, Trish, where are you?
The side bump.
So
The side bump.
Lateral.
The lateral side bump, there you go.
Yeah.
For the side that they are working on. Clamp goes on the bed, feed it through. He positions his PA, which I heard he has someone new, will position as well. That all lives on this. I have not had to use this yet. Ladies that have used it, this is for
Palma uses that.
Palma's
I had the key.
shoulders.
Yes, lateral.
Just the lateral.
They
The
hook it
T-bar.
up. That's all I know. Like he and his PA do all that.
And the chin straps.
Oh yeah. Also with beach chair, there are chin straps. So Andersani puts them on to keep the patient's head how he wants it and out of the way for when he's doing the shoulder.
And I have extra down in that area.
Perfect. Also Palma, so we have bean bags for patients for lateral positioning. Palma uses the extra large one. It's in the old anesthesia office right at the moment. This is the normal one that Kalish would use. We did get these big gels that you can put over them because when they harden, they can be hard and pressing into skin. They don't always get used, but you always want to have a sheet over your bean bag if you're not using the jelly. Ah, see, she's over there. So the new bean bags have this little like for your boot machine. There you go. When it's pushed in, it's going to suck the air out. Nice and firm. And then you just pop this out. You hit the button, it pops out, and that's what keeps the air in. To release the suction or whatever you want to, I should say the suction, you push it in, and it releases it out. Kalish is the one that likes to use this a lot for his Mac cases that need to be lateral. So whenever you see him with something on the back and it's a Mac, grab that bean bag because you know you're going lateral. And not that we use these hardly ever anymore, but I think Belgrade just had one not too long ago. Your stirrups. They live in the basement. Main thing with these is once you position your patient, if you have to, you're going to take off the bottom of the bed, obviously, drop the foot pegs. You get your patient positioned. You don't want a lot of pressure behind the knee. You want the foot seated in really well. The thing with these is you're going to bring both up at the same time, and you're going to bring both down at the same time. You don't want going one at a time, one at a time. And you got to watch how high. Does anybody know the degree?
I don't remember.
You don't want them too far out. You don't want them too close. You don't want them too high. Is it on there? Your little
This
thing.
is A or N, so maybe. I don't see a degree on
No, you just don't want to do them too high up. Same thing with arms. You don't want to put them more than a 90 degree. You know, if they're supine, but yet they're working on the bottom of the arm, you don't want them like wrenching on their shoulder. Well, also when you're lateral, you're going to want a pillow for the patient to hug, pillow under the head, pillow between the legs.
I have found in my experience when you're doing the bean bag for say for like Dr. Palma and you've got that blown up and it's all stiff and hard, it can be rough on their leg to make sure you put something on. A gel.
Anywhere where you think there's something hard against their skin or a joint, just make sure it's padded. Kupcha and Geary are good with their new procedures that they're doing. They roll something at the edge of the bed and then they want to frog leg the patient and put the other leg over top so that it's like this.
It's not gonna work.
Yeah, so you need, if you're a frog leg, you gotta make sure you're putting something under that knee to support it because that patient, they're gonna come out with hip pain if it's not supported. You want a gel between your ankle and your leg. Like anywhere where you're gonna have compression and possibility to have like redness, you're gonna want to gel it. Also, your safety strap, when it's over your thighs, 2 inches above the knees. They shouldn't be over the knee. You don't want it over bony prominence if you can help it. That's it.
Tracy, with Dr. Palma's bar
And
and
then
shoulder,
we'll-
make sure they have the.
Oh, the
feet
weights.
back, yeah.
So with Dr. Palma's little, yeah, I think there's two different sizes.
Here's a,
Again, he and or his PA will do this.
it goes on the end, so.
There's a little-
To extend the arm.
There's a weight.
Mhm.
This one's heavier, this one's lighter, and they will do
I
it.
think one's fine.
I'll make sure the seatbelt's tight.
Yeah, and make sure your seatbelts are snug. You don't want them loose because, you know, anything can happen. They should be firm against the leg, but not, you should be able to get your fingers under it and that's it.
Only thing I'd add is patient positioning is everybody's responsibility, and anesthesia is a great resource. They learn all the nerves. So if you're unsure if it's a good spot, I always just check with the anesthesia. They're usually pretty helpful with that.
Perfect.
Oh, speaking of tucking an arm, you want to pat it and you want to tuck it. You want your palm flat against your leg, thumb up. You're not going to go like this. You're not going to go like this. Pat it and tuck the sheet. And that's all I have.
ARN has really good cards that I printed out, so if we want to laminate them and leave them somewhere, we can. Kind of goes over all our basic positionings and what's important on them. Just
Perfect.
as a quick cheat sheet if you need one, if you haven't used a position in a while.
Okay.
Next.
Thank you.
Thank you.